Um, Hi there, I'm going to present data from our Transcare COVID-19 study. It was a global survey assessing the effects of COVID-19 on transgender and transgender health. At first, thanks to all who took part in our survey and all the community groups supporting our research. You can see them right on the lower part of this sheet. My name is Andreas Koehler. I receive a PhD scholarship by the Klaus and Simon Foundation Hamburg, and otherwise I do not have any other disclosures to make. So a few quick words concerning methodology of our study. The Transcare COVID-19 study was a web-based survey we developed in cooperation with 23 community organizations and was translated into 27 languages. It was open to everyone who was transgender and was at least 16 years of age, and we recruited via LGBTI-related social media channels or other LGBTI-related channels and snowball sampling. The study received ethics approval from both the ethics committees at the University Medical Center in Hamburg and from the Ghent University Hospital. There was no funding for the study, and data collection started in May 2020 and is still ongoing. So take a look at our website, maybe take part in our survey, or forward the survey to everyone who think might be eligible for participation. We assess demographical data, physical and mental health problems, behavioral risk factors, data on COVID, and how the COVID-19 pandemic influenced the access to transgender healthcare services. By August 9th, so this was the date of the last analysis of the whole sample, 5,267 transgender people from 63 higher middle income and high income countries participated in our study. I will only present to you data from these higher income countries, as the data from lower income countries aren't analyzed so far, and recruitment in those countries appears to be difficult. So if anyone in the audience wants to support recruitment in the countries still missing, feel free to contact me. So what did we found? We found that over 50% of our participants had risk factors for a severe course of a COVID-19 infection. And this was about 20% higher compared to the general population of most OSCE countries. Moreover, we found that our participants were at high risk to avoid testing and treatment of a potential COVID-19 infection, and this was due to their fear of mistreatment or discrimination as a trans person by healthcare providers. And finally, we found that over 50% of those participants who already had accessed transgender healthcare services experienced restrictions to those services. So amongst others, the access to hormones was restricted for more than 20% of our participants. Nearly 35% of surgeries were canceled or expected to be canceled, and 50% of those who recently had accessed this surgery had restrictions in terms of aftercare, surgical aftercare, for example, regarding wound healing problems. Moreover, more 40% of our participants experienced restrictions regarding counseling services, and even low threshold services like support groups were access to those was restricted for more than 2/3 of our participants. And with all that risks and restrictions in mind, we found that more than 1/3 of our participants had suicidal thoughts since the beginning of the pandemic, and 3.2% have attempted suicide since the beginning of COVID-19. So what are the key messages of our survey, of our study? We found that transgender people might suffer under the severity of the COVID-19 pandemic even more than the general population. And this was due to their status as a vulnerable social group because of their high amount of risk factors and their need for ongoing medical treatment. So the COVID-19 pandemic can potentiate these risk factors, um, can add new challenges for trans people, and can lead um, to devastating mental or physical health consequences for the transgender population. So I want to thank you for your interest. Again, we are very grateful to all who supported our research and took part in our survey. Feel free to contact me if you have any questions or remarks. Thank you so much.